Guys, thank you for participating in the simulation. This is our debriefing portion, and during this time, we're going to start off with getting a report from all three of you. And what I'll do initially is I'll call out, each and every one of you to take part in the different aspects of this debriefing process. So the first nurse that I'd call on is Nurse 1. Can you go ahead and give me a report on your patient? And after you give me your portion, I'll also call on Nurse 2 as well as Nurse 3. So go ahead, Nurse 1.
Okay, our patient's name is David Smith. Date of birth is January 21, 1945. Patient is a 75-year-old male admitted to the med-surg floor for episodes of confusion and complaints of headaches. Patient is temporarily staying with his niece while his daughter is on vacation for 2 weeks. He brought him to the ED because he wasn't eating much, was confused at times, and seemed to be in pain. Niece feels that he hasn't been taking, on top of taking his medications. Says his condition has been getting worse for the past 3 days. When asked about his history, niece says that he smokes and drinks on occasion. He had a mild heart attack in the past, and he's stubborn.
Joe, do we know if the patient is still smoking? I mean, she mentions that he smokes and drinks on occasion, but did we find out how much he smoked or?
About like, I think 1 pack a day.
Okay, 1 pack a day. How about the drinking?
Drinking, yes. She said that she's noticed some bottles or some glasses on the table with some alcohol in it.
But we just don't know how frequent the drinking is, correct?
No, not how frequent.
All right, well, maybe we should follow up on that. Okay, Nurse 2, why don't you go ahead and continue with the report, please?
Okay, the patient is awake, alert, and oriented ×4 and is cooperative. He is a full code. He is allergic to penicillin. His pupils are pearla. He does have a history of type 2 diabetes and a heart attack 5 years ago. His current vital signs are 165/92, SpO2 at 93%, heart rate 105, respirations of 20. He doesn't report any pain, 0 out of 10 on the pain scale. Blood sugar is 156. He also has had a normal output with urine of 800 mLs, as well as a normal BM of regular characteristics.
Okay, Nurse 1, can I cut you off real quick? So the vital signs that you were reading me, was that those were the vital signs when you first assessed the patient? Is that correct?
Is correct. His current vital signs, yes.
All right, and I don't know if I heard, but does he have a history of hypertension?
He does have a history of hypertension, type 2 diabetes, and a heart attack 5 years ago.
Okay, awesome. All right, Nurse 3, can you continue with the report, please?
So after the initial assessment, we went ahead and called the doctor and received the following orders. O2 per nasal cannula at 2 liters per minute. Administer Captopril 20 milligrams twice a day by mouth. Cardizem extended release 240 milligrams by mouth daily. And metformin 500 milligrams by mouth twice a day.
All right.
I'm sorry,
Nurse 3. Could you go ahead and start off with Captopril again? I lost you at Captopril.
Oh, I'm sorry. Yeah, Captopril 25 milligrams. That's by mouth twice a day.
Okay.
Cardizem extended release 240 milligrams by mouth daily. And metformin 500 milligrams twice a day by mouth. And patient was also to be put on fall precautions. Portable stat chest X-ray was ordered as well. Labs included CBC, CMP, and urinalysis. And we were to start an 18 gauge on the left arm, left antecubital saline lock.
Okay, awesome.
So then we went ahead and applied oxygen via nasal cannula in order to maintain the oxygen above 96%. Patient's currently at 2 liters per minute. Following administration of the medication, patient's blood pressure was 125/79, heart rate 74, respirations were 14, pain remained 0 out of 10, and we went ahead and called for labs, and chest x-ray as ordered and still waiting for the results.
You know, one of the things that we do want to acknowledge is obviously there's a change in modality with this type of simulation. We know that it's going to take a little bit more to adjust to this new format. Was there anything that you guys found difficult with this modality? Anybody? Nurse One?
Being disconnected from, it's not hands-on.
Okay.
That's really the biggest thing.
Okay. How about Nurse Two? Anything from your standpoint?
Just a different environment overall, you know. So I'm just adapting to that. You know, made it kind of a little difficult there.
Okay. How about Nurse Three?
I felt I had a little difficulty staying engaged at times.
Okay. All right. Well, thank you for that. Now at this point, I do want to talk about the positive events that you can identify as you guys were navigating through this simulation. Nurse One, can you tell me something about any positive events that you identified?
I liked how interactive it was when I was going through sim, especially because it's not, it doesn't feel like a case study.
Mm-hmm.
It is much more, it's just real time.
Okay,
Basically.
very good. Nurse Two.
You know, because I was able to able to communicate directly with the patient, it helped me visualize concepts and skills at my own pace.
Mm-hmm.
It helped me realize why the patient was there in the first place.
Okay, thank you. Nurse Three.
I like that I was able to visualize the vital signs prior to the interventions, and then in real time being able to see the effect of the interventions in updated vital signs afterwards.
How about some items that you identified that you needed to improve on? What do you think, Nurse One?
I think my assessment skills, I think I need to be more systematic and thorough.
Okay.
I felt a little scattered.
I see. All right, how about Nurse Two?
I think I need to improve upon my communication skills with the doctor, but it's kind of hard with this type of simulation. I wish I had a chance to do some actual exercise where I'm actually talking to someone type of a thing.
Okay, all right. Nurse Three?
I kind of wish I kept better communication with the patient, just continually updating him on what was going on and what I was doing more often.
I see. This simulation, again, is a different type of modality, but our hopes that as you were navigating through this simulation, that you would meet some of our objectives. And our objectives for this particular simulation, there were 4 of them. The first one was that all of you would be able to perform an assessment on this patient. Second objective that we also had for you was that you would formulate a plan of care for a patient with hypertension. Okay. The third objective that we had was making sure that you would communicate and collaborate with the doctor to manage this patient with hypertension. And the fourth objective was to evaluate the effectiveness of the interventions for your patient regarding their hypertension. During this time, do you have any major questions regarding this patient that you took care of?
Whether he was under the influence prior to being here, right?
Okay.
Being in the hospital.
Okay, we possibly could have, if we had any suspicions with that, maybe we could have collaborated with a physician and possibly do a tox report, have him order a tox report. That would be great. Anything else, guys?
I think maybe getting a better understanding of the patient's understanding of how to manage his medications themselves.
Okay, yeah. And possibly, collaborating with, maybe family members and identifying any family members that might be able to help them, help him rather be compliant with his medications. That would be great. Anything else, guys?
I'd be interested to know if this was an isolated incidence of non-compliance or if this is a pattern of behavior with this patient.
Oh, that'd be great. That'd be great. Awesome. Thank you, everybody, for your participation in this debriefing process. Today, in summary, we wanted to let you know that you had cared for a hypertensive geriatric patient who was having difficulty taking his medications consistently. Today, you were able to conduct your assessments on this hypertensive patient. You were able to create a plan of care for your patient, collaborate with the patient's primary provider, and implement and evaluate interventions based on this collaboration and your plan of care. We want to remind you to make sure that we maintain confidentiality of this exercise And on top of that, we also want you to complete your simulation evaluation too. Thank you so much for everything, and we will see you in the next activity.